Well, good morning. This special meeting of the St. Johns County Board of County Commissioners is being conducted with Governor DeSantis' Executive Order number 20-69, suspending the requirement of a physical quorum and providing for a virtual quorum due to the current state of emergency in the state resulting from the spread of novel coronavirus COVID-19. In order to further mitigate the transmission of the coronavirus and reduce risk of COVID-19 illness, the Board of County Commissioners has adopted procedures to conduct meetings using remote participation through Emergency Proclamation number 2020-3 so that the public has a means to comment during the meeting without physically attending. Along with prior communications, including email, the public will be able to comment by telephone while watching the meeting via GTV or by streaming posted on the county's website. This agenda is published and present. We have agenda item number 1, which is emergency management update. Mr. Conrad.
Good morning, Mr. Chair, Commissioners. A quick update for you this morning. To get started, an update on the numbers of COVID-19 in St. Johns County as of 7:30 this morning. As you know, obviously subject to change twice a day. This morning we currently have 143 positive residents of COVID-19, 4 non-residents, 23 hospitalizations, and 2 deaths to this point. We have seen a decrease in the positive cases over the last 2 days. I'm not a scientist and I'm not an economist, so I can't tell you whether that's going to continue to trend or not, but from Tuesday to Saturday of last week, we saw north of 10 or more every single day. On Sunday, we had 7 cases, and yesterday we had 4 cases. We don't know what today holds or tomorrow. Obviously, as you've heard and the listening public's heard, that the peak may be late April, early May. It's kind of all over there. So I'm not surmising whether or not that we've reached that peak, but a little bit of good news that our case counts have dropped over the last couple of days, and I wanted to share that with you. Additionally, the state average for testing positive is just about 11%. It's at 10.8% as of this morning. The county's positive testing rate is at 6.3%. So we're also doing a little bit better than the state average by those who are testing positive. For the listening public, I know the 5 of you are aware, we still have the 4 sites available for testing. We have the Department of Health, we have Flagler Health, Abyssina Medical, and the regional site at TIAA Field. That's the regional site up in Jacksonville. Once again, I would encourage anybody who's listening to go to the website to be able to determine what the requirements are. Each site has different requirements as to who they're seeing, how they're seeing them, and the times of day they're being seen. I did want to give you a quick update. We received a donation yesterday from a private citizen of 300 of the rapid test kits. I won't go into the medical efficacy of that because I'm not familiar with it. What I do know is at this point, they're not FDA approved, so we're not distributing them out yet to use because we don't know whether or not they're going to get FDA approved. We assume that we've heard that they're going to get approved here pretty soon. We have given 10 to Flagler Health for them to test basically in conjunction with the rapid, the general testing. But the rapid test kits give you answers back within about 15 minutes. But again, we have those on site. We're waiting to see if they're going to get FDA approved. And then if we do, we'll distribute those to the providers for them to determine how they want to use them. And then the last thing I just want to give you a quick update on, we've heard a little bit in the media, there's been a question about bed space both around the state, here locally. And I want to give you an update as of where Flagler Health is as of yesterday. I don't think I've heard from emergency management this morning. We don't see any significant change from yesterday to today, but just a quick update. Flagler Health has 330 beds. Currently, they have 200 beds available. Now, those 130 that are being used are not all for COVID. That's for everything in the hospital. So their current bed space left as of today is 200 beds. In regards to COVID-19, they have also prepared a second and a third site to set up if necessary. Obviously, we're hoping it doesn't reach that point. And as you heard, they have a significant amount of space available. So at this point, as far as bed space, there is a good amount in St. Johns County, as well as there are site preparations for a second, third, and potentially a county-sponsored 4th site, but we're just doing the logistics on that right now. So I'm going to turn it over to Dr. Allicott, the Department of Health, and then Ms. Stoughton in Emergency Management, and I'll stand by for any questions that you may have with me.
Thank you, Mr. Conrad.
Yes, sir.
Dr. Allicott, good morning.
Good morning. Director and Health Officer, Medical Director of the Department of Health in St. Johns County. Just give you a little update on COVID-19. Regarding our stay-at-home order, since I last spoke with you last week, our governor did issue Executive Order 29-1 requiring all persons in Florida to limit their movements and personal interactions outside of their home to only those necessary to obtain or provide essential services or conduct essential services or activities for 30 days. That order went into effect at the end of the week last week. Regarding our COVID-19 cases, the Department of Health has updated its dashboard, and you're able to see updates twice a day. Also to zip codes. We don't have zip codes for St. Johns County as of yet, but the bigger counties have been able to drill it to the zip codes. As Mr. Conrad shared, the information on the numbers that we have positive, our positivity rate, yes, is less than the state rate. Our hospitalization rate, however, is higher than the state rate. The reality is that these are all data points, and as Mr. Conrad shared, this is our understanding the peak may be somewhere toward the end of April. So we're looking at that. Early research indicates that up to 25% of people who become infected with COVID-19 may never have any symptoms. And those who develop symptoms may not do so until 48 hours before they actually become infected. This is important. Why? Because now we have individuals that may not have any symptoms that contribute to the transmission, and in fact, they do contribute to the transmission. And then we have asymptomatic transmitters, and we have individuals who are transmitting 48 hours before they become symptomatic. And that's different to what we understood of the science prior to about a few weeks ago. Commissioner Smith, you asked about virus activity in warmer weather last week. Most respiratory viruses have a seasonality to them. So it's been hypothesized that moving into the summer season, we may see transmission decrease as the virus then moves into the southern hemisphere, as we've seen and usually see with the flu virus. This would give us an opportunity to work with the many mitigation strategies to get ready in the event we have a second wave in fall, winter of the coming year. Mitigation strategy, social distancing. This is actually a very significant tool in our arsenal, which if embraced fully can lead to more optimal decrease in viral transmission. This virus cannot actually go from person to person. It needs us to be close together to make it happen. And in fact, it needs us to be within 6 feet of each other. It's really great to see our setup here because it gives one the understanding of social distancing. So if we just distance ourselves from each other, the virus cannot sustain itself and would peter out, halting the spread. So there's a graphic that I saw on YouTube. It's a viral match video. They lined up matches, they lit them, and they just kept on lighting, and then they took one out. It diffused. It's a similar picture with the virus. So social distancing is a must. CDC has had some discussion, or lots of discussion, about mask recommendations. There are two ways to look at masks. Is the mask something that protects me? Or if I wear a mask, is it something that protects others from me? Those are the considerations with masks. Obviously, in the healthcare setting, we're working sometimes with clients, we are working with people coming from the outside in. Obviously, it's recommended in a healthcare setting. Monitoring. When the Department of Health receives notification of persons tested positive for COVID-19, we conduct an epidemiological investigation, disease control type of picture based on CDC guidance to identify individuals who may have had close contact with the virus. Those individuals are instructed to self-isolate for 14 days after their exposure to the virus and to contact the health department and their primary care provider. Most importantly, what we do in public health is focus on early case identification, isolation, and contact tracing, attempting to curb the spread of the disease. That's one of our main goals. Long-term care facilities. Last week when I spoke with you, I shared that as one of the critical areas we monitor daily, trying to limit the outbreaks. Just a handful could create quite a situation in our long-term care facilities. So we are very concerned about those who are elderly and those with significant medical conditions. We also understand, however, it can impact those who are 20, 30, 40, 50 years old. they can get really sick as well. So we are interested in all our population, but the vulnerable population in terms of the elderly and those with comorbid disorders, we obviously rank in a way to stratify and appropriately get to those that are critical first. On a softer note, at the end of the day, most of us will recover. Everyone plays a role in lowering the impact within our communities and workplaces. Taking everyday preventative actions helps to impede the spread of respiratory diseases. As a reminder, the best and most up-to-date information is available at www.flhealth.gov/COVID-19. This information, as I said, is updated twice daily, and it would be remiss of me if I don't reiterate about social distancing, cough into our arm or sleeve, ensuring that at all times we wash our hands or use an alcohol type of sanitizer that has 60% alcohol. And with that in mind, stay home if we're sick. Thank you.
Thank you, Dr. Alicante. Ms. Stoughton, good morning.
Good morning, Linda Stoughton, Director of Emergency Management, St. Johns County, 100 EOC Drive. I want to start out this morning talking a little bit about the operations of the EOC. We remain at a level 2. We are participating in all state and federal conference calls, and many of our emergency support functions, we're also using that method to communicate with them without having to bring large groups to the Emergency Operations Center. So while it looks like there's a small group inside, there's a larger group on the outside that is feeding information into the Emergency Operations Center. One of our other big operations this week was the implementation of the Executive Order 2091 with the non-essential and essential. Many calls that came into the Citizens Information Center, both at the EOC, the Sheriff's Office, and the Department of Health, how to interpret that. So we tried to give tools. The state sent down some tools that we were able to get to our public information. Mr. Conrad's group trying to get those frequently asked questions out to understand what that meant to the public. So that was a heavy lift for a couple days trying to peel that back and make sure that we understood what that meant. On the logistics side, we have started pushing small-scale amounts out to our community programs of shelf-stable meals. We have received some calls at the Emergency Operations Center for some of our residents that need food. So we have worked with our volunteer organizations active in disasters to provide them shelf-stable meals that we receive from the state of Florida so that they can help with this with our residents, because the number one thing is we want them to have food to continue at their homes, to mainly the people over 65 that are not moving around inside of our community. This week, total, throughout the disaster, we have received 126 cases of medical supplies and 298 boxes of different supplies coming in through the state of Florida. We're also expected to receive a shipment tomorrow. Those supplies that come in are distributed to first responders, Flagler Hospital, and our healthcare facilities throughout the community, also with operations within St. Johns County and any of the municipalities, such as Council on Aging, Medical Examiner, those type of organizations that need those to continue their operations. So we continue to roll that stock out as quickly as it comes in to the logistical staging area, pushing it out for use. On the planning side, we push out situation reports. We've got positive feedback and suggestions. Commissioner Waldron gave us a great suggestion a couple weeks ago, and we implemented that. We continue to get suggestions on how that's going to better serve our audience. So if people have suggestions, please contact the EOC so we can make that a better useful tool for you. We continue with contingency planning. Flagler Hospital does a lot of interior modeling for us as to what's going on inside their hospital and how that relates to the different models that are going on throughout the country. So I have a big board set up in the EOC that they share with everybody inside the EOC that feeds into our contingency planning. At this point, we're not ready to describe those plans to you, but we will in the future. But know that if the numbers do change and grow, that we are planning in the EOC to accommodate that inside of our community. So that kind of boils down to us monitoring the trends, seeing what's going on throughout Florida, and what the needs of our community are going to be, our unmet needs. And that's all I have for you today, unless you have any questions.
Thank you, Mrs. Stoughton.
Thank you.
Good morning.
Mr. Chair.
Mr. Chair, Commissioner, staff, thanks for allowing me to speak. Rob Harvey, Chief of Police, St. Augustine Beach. I just wanted to deliver a message from Jacksonville Beach Chief of Police, Gene Paul Smith. We had discussions, of course, as you know, the emails we were receiving in reference to lifting restrictions on our beaches. And I wanted to make sure that we were kind of on the same sheet of music with the Jacksonville Beach Chief of Police too as well, because it directly affects them as well. So as of yesterday in a conference call with the other law enforcement executives in Duval County, and at this time they are not discussing lifting restrictions on the Jacksonville Beach and Neptune Beach and Atlantic Beach at this time. However, they are open for discussion after the holiday weekend. So they wanted me to relay that message to you from Gene Paul Smith from Jacksonville Beach, and I think it's important that we remain in contact with them on a daily basis.
Thank you very, very much.
Yes, sir.
Appreciate that, Chief.
Okay, at this time, the board will hear public comment on matters that are not on the regular agenda. Regular agenda items will have their own public comment, but you can make comments on what we've had this morning. Any person wishing to address the board should come to a podium, state his or her name and address. Each person will be provided 3 minutes to speak and shall comply with the board's rules of decorum.
Morning. How are you guys doing? Thank you guys for being leaders in this really tough time. I really appreciate it. People I've talked to, Chief Harper.
Just state your name and address.
Okay. My name is Christopher Rapero. I live at 503 Ericola Avenue, St. Augustine, Florida, Davis Shores. I'm coming to speak to you guys today because I don't underestimate or undervalue the situation that we're all in. It's scary, it's uncharted territory, but I'm unemployed through the situation. I've lost both my jobs. I Airbnb, it's closed. I've talked to first responder officials. This thing's serious, and it scares me. But at the end of the day, when I go home and our beaches are closed and we can't access them, it makes the situation a lot more oppressive and intense. And not being able to go and exercise or walk on the beach or get in the water is a factor, and our community has spoken pretty loudly that they feel the same way, and I wanted to be a voice for them to communicate that to you guys. And if we could create some kind of option, even if it's a small window in the mornings for sunrises and things like that, to practice active social distancing, we'd be greatly appreciative. Keeping the parking closed, and just trying to find a way for just to use local traffic to be able to get outside their homes and walk on the beach in a safe, active manner would be something I hope that we could think about and consider. And I hope that no one takes, like the nurses and all the doctors working hard in this situation, they don't think that I don't take lightly the situation. But I think that finding a balance, that we have a beach community, and not having the beaches really changes the community. If we could find a better balance to help the community, because I think having it completely closed is maybe not okay, but having it completely open is not okay either. So if we could consider that, and if I could play a role in that and be helpful, I would love to. And thank you guys again for all that you guys are doing in this tough time.
Thank you.
Thank you, Chris.
Good morning.
Good morning, Commissioners, Mr. Administrator. My name is Eric Hires. I live on 9 Eugene Place, 32080 on the island. Thank you guys very much for all your work you've been doing these last few weeks. I talked to Commissioner Waldron last week, and he said you guys worked 21 days straight, and we just appreciate what y'all are doing for our county and our communities here. I sat down and wrote up that petition last Sunday, hoping to get 500 signatures on it, and it was over 11,000 this morning of people who support the beaches reopen and are having some sort of access to the beach. And when we first wrote it, you know, I don't know if, I'm sure you guys have heard about it and looked it over. But you know, we were originally asking for some things that aren't really practical and hard to enforce. We understand that. And after talking with some law enforcement and some community leaders, our stance has evolved to just asking for, or what we think might be a possible solution for you guys to consider, is to open the beaches for movement. No chairs, no towels, walking, jogging, swimming, surfing, you gotta be moving. And the law enforcement we talked to felt like this would be fairly easy to enforce. They're already out there enforcing the closures. So that's one possible solution. And what really, we all want the same thing. We're all just trying to do what's best for our communities in this time, trying to do what's best for the safety of all our citizens. And there's a large portion of the population that believes that total health is important, mental health is important. Be able to get outside and breathe some fresh air and get some exercise is important. And you know, when I spend a lot of time on A1A and live on the island, and just seeing all these elderly people that's part of their routine. They get up and they walk the beach every morning, and they go for a walk at sunset, and just seeing them walking up and down A1A on the sidewalks is sad. You know, these people, that's just part of their lives and how they get a lot of their peace and deal with a lot of their stress and tension in these times. So thank you very much for what you're doing. Please consider this. It's really important to a lot of our citizens. Thank you.
Thank you, Mr. Howard.
Thank you.
Morning. Tom Reynolds, 50 Brigantine Court. I see we're on number 1. I was wondering if the sheriff spoke today in regards to, I got in here a little bit late, in regards to the men and women, and if he's got enough protection for them. You commissioners are already speaking to him, but the public is not aware if he needs any further equipment or anything. Also, too, are we going to be getting any updates from the Chamber of Commerce today? What they're doing to help the businesses? Also, too, legal aid, what they're helping to do for the renters. Will we be getting any update today from Council on Aging, Executive Director here, letting us know how the elderly people are doing and what they're talking about? And as far as for the beach, if you're taking comment on that right now, opening the beach, I want to remind you, the beach belongs to everybody. $60 million was spent. Don't open it up for one class of people. If you are going to open it up, it's a tough decision. I don't know what I would do right now if I was in your shoes and seats. But, you know, just moving forward, but also like to take the time to recognize that, you know, mental health is very important. But real health is also just as important. And the decisions you make, if you decide to open that beach up, I don't know, it could cost somebody their life. So I hope you've studied the issue. I hope if you make that decision today to open the beach up, it's all or none. Open the parking lots or keep the beaches closed. Because closing the parking lots is really only hurting people that want to come to the beach. And that beach is going to need renourishment very soon. It's ahead about 18 months of that beach depleting. It's going to need 60, 80, $100 million more. Just county residents, just St. Augustine Beach residents, that's just not them paying for it. It's people all over. Thank you.
Thank you, Mr. President.
We'll now hear from callers.
Hello?
Yes, sir. Can we get your name and address for the record, please?
Yeah, my name is Don Rexa. Yeah, can you hear me? My name is
Yes, sir.
Rexa. I live at 548 Domenico Circle in St. Augustine Shores. Are you hearing me?
Yes, sir.
Okay. I have some comments about some of the numbers that I've been seeing in the paper that have been put in there. And I've been tracking this thing for a while, and maybe somebody can comment on this because it looks like St. John's is out of proportion to the surrounding areas. Today's numbers, for example, St. John's County has 146 cases. Clay County, which is somewhat similar in size to St. John's, has only 81 cases. And then if we look at Duval, which is approximately 4 times the size of St. John's County, they have 475 cases. And if I take a quarter of that, which would be what St. John's County should have, that number is 119. So we have 146. And it looks like if we were anywhere in the vicinity of Duval, we should have 119. So I've been tracking this for days, And in all my numbers, and I've got a graph on it as well, St. Johns County looks like it's going straight up on the chart. And it also looks like that we are proportionately higher than our surrounding areas. And I don't know if anybody can comment on that.
Yes, sir. I don't see anybody with an answer to that for you right now, sir. Yeah, can we get your name and address for the record, please?
Yes, my name is Susan Riley. I live at 826 A1A Beach Boulevard in St. Augustine. And I'd like to thank the county manager for closing our beaches. I think this order has saved lives during this pandemic. As you know, the beaches are closed to the north of us and the south of us. Please don't jeopardize our population of almost 500,000 people, because 5% of the population have signed a petition to reopen the beaches. There's no way to enforce what the surfing community is suggesting, and this is going to put an undue hardship on the St. Augustine Beach Police and the St. Johns County Sheriff's Office, and an undue hardship on the medical community, who are begging people to stay at home. I think it's very selfish of people who are not willing to give up their hobbies for a few weeks or months to save lives of their fellow citizens. Scientists and medical professionals are saying the only way to stop the spread of the coronavirus is to stay at home and wash your hands. If you must go out, wear a mask, stay at least 6 feet away from people. I don't see how playing at the beach adheres to any of the guidance we have received. Perhaps the surfers are not aware that 30% of the deaths are people under 40. This virus kills young people too. It makes you very sick, requiring hospitalization, and leaves you with lifelong health issues when you recover. My husband and I used to walk the beach every day, but we are willing to make this personal sacrifice because we know staying at home will help stop the spread of this highly contagious and deadly virus. It's a sacrifice we're willing to make to save lives. The Surgeon General, the President, the Governor have all said to brace yourself over the next 2 weeks, because we're going to see over 250,000 deaths. The World Health Organization is recommending everyone must wear masks if they must go outside for an emergency or a life essential errand. Our governor has ordered a stay-at-home order for the entire month. So opening the beaches just does not make any sense. To me, it would violate the governor's stay-at-home order. And I don't know why at this time anybody would sign a petition to increase the number of Florida residents who are infected and dying. I don't know why you're being asked to consider opening the beaches, but please continue to follow the guidance of the World Health Organization and the CDC and keep our beaches and community pools closed, because the life that you save may be your own. Thank you.
Yes, ma'am. Thank you.
Hello, my name is Carl Gill. I live at 58 Village Del Lago Circle on St. Augustine Beach.
Yes, sir.
And I have seen people walking down the beach over the last year or so, and most recently, they have been practicing social distancing. So I can understand a little bit of what was going on. Ron DeSantis said we should do exercise and keep fit, and I think opening the beach for a certain number of hours would help that. And the last thing is, the only option that people have when the beach is closed is to walk down A1A, the sidewalk there, which is very, very narrow, and really goes against CDC rules. So I encourage you, along with 11,000 other people, to open that beach as soon as we can, just for limited times, up to 11, say, from sunrise and 5 till sunset would work really well. Thank you.
Thank you, sir.
Yes, it's Darby Moore, and I live at 5230 North Avenue.
Yes, ma'am. Go ahead with your comment.
Okay, great. I am a lifelong resident of St. Augustine Beach. I have worked and contributed to this community since I was 15 years old, which is a very long time ago. First of all, I think everyone would like to thank you for all the work that everyone has been putting in. nobody envies being in your position right now. We know that it's a tough decision. Mental health is health. I would like to point that out first and foremost. Physical and mental health, there is no differentiation between the two. By opening the beach to movement, you're providing a platform for people who are jobless, who are relatively homeless right now. I've lost both of my jobs during this time. I've worked 2 jobs for the last 10 years. By not having that time to fill, surfing is a refuge for people. And it's not true to say that counties to the north and south of us are closing their beaches. To the contrary, Volusia County has worked out a situation to where they are allowing the beaches for movement. There are surfers, there are beach walkers that are able to participate within a limited number of hours. The practices that make them feel best, that give them hope and encouragement in this time. And I think that that's key to the health and survival of a lot of people that contribute to the ability of the city to thrive when these beaches are available to be used and when businesses are open. We're all but begging for some sort of consideration of the middle ground. 11,000 people are in need of this refuge, and limited hours, proper social distancing, the closure of public parking, which is rife for congregation, I think is the middle ground between those two solutions. Again, thank you, and thank you for giving us a platform to share our opinions.
Yes, ma'am, thank you.
Yes, good morning. This is Sherry Carmichael, and I'm a resident. I live on 213 3rd Street in St. Augustine Beach.
Yes, ma'am. Go ahead with your comment.
Yeah, thank you for taking our suggestions, and thank you for all of your hard work. I'm an avid dog walker, and I see many people that do walk their dogs in the morning. I'm in the early crowd. And I think that it's important for the beaches to be open because we are all crowded on A1A. I see it every morning, and really we're only suggesting for the beaches to be open from dawn till 11, just for people to get their exercise. I have to agree with the one caller that said there are many older people that want to walk and get their exercise. And it seems that it makes sense that if the beaches are open, we have more room to spread out, because right now we really are crowded. There's bikers, there's walkers, and I do understand the importance of staying indoors for most of the time, but the people are still going to want to exercise, they're still going to want to get outside. And I think that is just important for mental health, for physical well-being, to be outside there. And the beach is one of the most important places to get that. And it is open space. So that is just how a lot of us feel in the community. And we can keep our social distancing much better because we have more room. On the sidewalks, we are crowded. There's people jumping into the bike lanes to get out of the way. And I feel that we're not able to do our social distancing on the sidewalk. And so I did sign the petition, and I just hope that you will be able to look at that and maybe find a way to have that open space for us, for the residents. And we aren't asking for all day, we're just asking for, residents just for that part-time in the morning, get out and get that fresh air and be able to have open space. So thank you.
Yes, ma'am. Thank you for your comment.
Thank you very much. Bye-bye.
Hi, my name is Michelle Bond. It's 5379 Atlantic View, and that's 32080.
Yes, ma'am. Go ahead.
Hi, I'm sure like so many other people, they're calling in regard, well, I'm calling in regard to reopening the beaches for at least local residents, if not just, I hate to say the island, but we live here and have, this part of the county is not like Mickler, it's not like the rest of the northern part of the county. We were pretty much going by the social distancing prior to it closing. But right now we just have a lot of retired people, and I am the only children, so we're specific pretty much in the entire neighborhood. So we don't have a yard. We have a street, which the county refuses to put speed bumps on. That's fine, we've ignored it. But we don't have anywhere for them to go. And their life is already really different right now with not going to school and homeschooling. And then not only that, we have a police officer sitting there that we view from our third floor every day with their lights on. And that's disconcerting for children. So for us specifically, just being able to go out and let them run around like they always have would be really nice. But what's happened is we actually have more traffic in the street with people in a more condensed area because they're all not just, now they're not on the beach, they're on the streets, which is fine because everyone's still talking, but they're closer together than they were when the beach was open. So I'm not really sure how that benefits, but having a police car sitting there, and nothing against the police at all. It's not, they're just doing what they have to, what they've been told to do. But for us, and I have a 7-year-old who's walking around right now, but every single day, every single morning, he looks out now and there's a cop with lights on. Children equate that to something's wrong. They already know something's wrong. Nothing's normal. Our neighbors walk around with masks. Like they're not in school. They don't see their friends. They can't go to the grocery store. Like they know everything's not right. And then on top of that, my kids can't go to the beach where they've been going ever since they were literally born here in this house. And there's nothing normal for us. There's nothing normal for our children. There's nothing normal for our neighbors who are all retired. They have their clockwork. You see the same people every single day with the same dogs, the same people. They're out exercising for their own mental health. And for us to not be able to go on and just walk and be on the only open space that we have available to us. Other people may have yards, good for them. But we pay a lot of taxes, and we did this on purpose, to live near a beach that now we can look at and not go to. So that's my only point. Well, 2 points. One was the lights, do they really need to be on? And 2 is, can we just use it for recreation? Just, we're not going to camp and put beach umbrellas up and have, we didn't before have huge crowds of people. But right now, other counties have done it and done it successfully. So I thank you very much. I hope you all have a very blessed day. And I'm sure it's not the first time you've heard any of this, but that's all I really wanted to say.
Yes, ma'am. Thank you for your comments. Address for the record.
It's Nicole Crosby. I live at 1169 Neck Road in Ponte Vedra. And can I go and start talking?
Yes, ma'am.
Okay. I just want to say that, of course, I love the beach and I miss it like everybody does, and I look forward to the day that I can be walking on it again and enjoying it. However, I don't think we're there yet, even in a partial reopening way. I don't think that we're there yet. I want to caution you about numbers coming from change.org. I believe that's who sponsored the petition. It's a wonderful, petitions are a wonderful tool, but they have to be used very carefully. I know my own experience with change.org. If somebody makes a donation, even at $5 or $10, it boosts that petition nationwide. And so you've got signers from all over the country or places certainly well beyond St. Johns County. Unless the originator of the petition is sending you the number of signers in the zip codes in St. Johns County, as I've done with you all before on another petition, you really don't have an accurate number of how many signers there are. So please consider that, how many signers are living actually in St. Johns County. The other thing I want to mention is this petition advocated for getting IDs of people who live in St. Johns County. I just don't think that's logistically possible because there's so many entry points, just in Ponte Vedra alone, much less countywide. If we station officers or personnel at all of those entry points checking IDs, I just don't think that that's realistic. And finally, I want to say that even though it may be being, not so easy to transmit the disease out in the open air of the beach. I think the big concern is going to and from the beach. It's encouraging more people to carpool to the beach because, of course, parking spaces are going to be tight. And then you're going to have people driving in a half hour, maybe even 1 hour round trips to get to the beach in the enclosed car. And I just saw on a mainstream news television bulletin this morning that they're now considering the possibility that COVID-19 could be transmitted through speech, just through speech. In other words, you don't have to sneeze or cough on somebody, but just be talking. So, we're still learning about this disease. We're still learning about how it can be transmitted. I don't think we should take steps that are going to put people in close quarters with each other, young people sharing cars, and possibly transmitting the disease to and from the beach. So those are my main points, and I just would really ask you to not take that step at this time, although, of course, like the others, I certainly look forward to the beach being open. I sympathize with the surfers. I'm sad that they're missing all these great waves, but I think they need to really look at their parents and their grandparents and consider what risk they could be, exposing them to.
Okay,
Thank you for hearing my point of view.
Thank you for your comments.
Okay, take it away.
Good morning. Please state your name and address for the record.
Good morning. My name is Mike Riley. I'm 826 A1A.
Yes, sir. Go ahead, Mike.
Okay. I'm calling in this morning to voice my opinion on the current closure of the beaches, which I am in favor of, and the thought of reopening the beaches, in my mind, at this point, is absolutely preposterous. Okay, I commend St. Johns County for acting and closing them down, but the idea that we are going to open them up prematurely it's just outside of the realm of logic. Okay, right now, of the 67 counties in the state of Florida, St. John's is in the top 15 of cases and deaths. It's projected that the state of Florida is going to double the number of deaths every 2 to 3 days. Okay, by the end of this month, our numbers statewide are going to be in the thousands. When we get to that point, that loss of life, everyone in the room is going to reflect and hope and wish that they had done everything in their power to mitigate that loss of life. Opening up the beaches right now would be a tragic mistake, okay? I understand it. I get that people are going a little stir crazy right now, but the priority should not be a nice walk on the beach. The priority should be keeping as many people safe and as many people alive as possible. I really implore the board. You need to act in the best interest of your people and your constituents, and we need to follow the national trend of social distancing. Okay, boardwalks to the beach are too narrow to actually follow social distancing. That's going to be your access point. I understand explanation, but the idea that people are going to be walking out to the beach and actually observe social distancing is totally absurd. This action to try to reopen it will directly cause more deaths. I mean, that's the long and short of it, okay? And you just don't want to be sitting here a month from now regretting this decision. That's all I really have to say. I hope you all make the right decision. Thank you for your time.
Yes, sir. Thank you.
Today's St. Johns County emergency meeting, after the, talking about infections, of how many people in the hospital, supplies coming in to deal with the coronavirus emergency in the state, and all those numbers. Also, I believe the police chief of St. Augustine Beach talked of how Duval isn't really, I guess, closing the beaches like we are, or Volusia. I guess all the comments that came after that, almost all of them, was about those who wanted the beach open and those who wanted the beach closed and those who wanted the beach partially open. So those who had the argument to open the beach was basically mental health. They're stir crazy inside their apartments with their children. They want to walk, and they feel that if they go then to A1A, everybody's there, the bicycles are there, the dog walkers are there, and so are you really stopping people from meeting? And you could keep that same distance basically on the beach, and this was kind of their argument. For those who were against opening the beaches, it was basically saying that, you know, this is an emergency. You cannot surf or take a walk for a while on the beach because you're saving lives. And if you save one life, you save quite a lot. So those were the comments. The commissioners that were there listened, and whether they'll do something about that, we'll see. But that was basically the emergency meeting of today. And we'll see as the week goes. We're supposed to hit peaks around April 21st, which is my birthday. Strange. But we'll see what those numbers are. And every day is a new day in this fight against the virus and trying to get back to normal. And a lot of people who spoke had lost their jobs or had lost all their jobs, because many people work 2-3 jobs, and this is really, really impacting them economically. That's it for today, April 7th, 2020.